As of Tuesday midday, over 3.5 million Chinese netizens had signed an open letter demanding that the World Health Organization, WHO, examine the origins of COVID-19 at the US Fort Detrick lab, and the number is still growing rapidly. The letter came as the WHO proposed a second phase of research into the origins of the coronavirus in China on Friday, including audits of laboratories and markets in Wuhan, and urged authorities to be transparent. The Chinese Foreign Ministry stated on Monday that the current plan contradicted China's and many other countries' positions, and encouraged the WHO to engage with the international community to stop the politicization of the COVID-19 origins issue. A group of Chinese internet users wrote an open letter to the World Health Organization, WHO, requesting that the WHO examine the U.S. Army Medical Research Institute of Infectious Diseases, USAMRIID, in Fort Detrick, Maryland. On Saturday, the Global Times was entrusted with posting the letter on its WeChat and Weibo platforms to encourage public response. According to the letter, the WHO should pay special attention to labs that are doing investigations on deadly diseases or even biochemical weapons in order to prevent the next outbreak. The Fort Detrick lab, which houses the world's most dangerous and infectious viruses, including Ebola, smallpox, SARS, MERS, and the new coronavirus, was singled out in the open letter. Any of them leaking would put the globe in grave risk. The same group had previously written an open letter in June seeking for an investigation of Fort Detrick by the WHO. As of press time Monday, over 90% of the 18,000 respondents to an online survey conducted by the Global Times agreed that the WHO should investigate the Fort Detrick biological lab. Zhao Lijian, a spokesperson for the Chinese Foreign Ministry, said during a press conference on Monday that the U.S. should be transparent and answer the calls of the international community, including the Chinese, and respond satisfactorily to the open letter and online poll. The public and the media are attempting to obtain answers to questions that have been posed by the international community for some time. However, Zhao claims that some persons in the United States have been keeping the public in the dark. Please respond to the following inquiries. To begin, what is the link between the Fort Detrick lab and unexplained respiratory ailments, such as those linked to vaping? Second, why hasn't the U.S. invited the WHO to investigate Fort Detrick thoroughly? Third, because international scientists have visited China, why can't they visit the United States to trace virus origins? Zhao inquired. Zhao criticized WHO's recommendation for a follow-up research into the origins, saying it contradicted China's and many other countries' positions. China wishes that the WHO will maintain open and transparent communication with member states, listen to and adopt all parties' viewpoints, and guarantee that the Phase 2 study is drafted in an open and transparent manner. China is concerned about some countries' politicization of coronavirus origins tracing. We hope that the WHO, in the spirit of scientific impartiality and professionalism, will collaborate with the world community to halt the politicization of the issue, Zhao said. Almost all circulating coronavirus variations have been found in the United States, according to Yangthan Kuiyu, a deputy director of Wuhan University's Pathogen Biology Department. By contrast, the viral strain discovered in China had no resemblance to several versions. As a result, Yang believes it is legitimate to conduct a virus origins investigation in the United States. The virologist also demanded that the U.S. bring over blood samples from those COVID-19 patients, as well as more information regarding the country's epidemiologic survey, in order to provide a fuller picture of the relationship between U.S. and international cases. Blood samples dating back to the 1980s are kept in U.S. labs, he claims. In June, researchers found that 7 people in 5 states, Illinois, Massachusetts, Mississippi, Pennsylvania, and Wisconsin, may have been infected with COVID-19 well before the country's first confirmed cases were reported on January 21, 2020, according to a study of more than 24,000 samples taken for a National Institutes of Health (NIH) research program in the U.S. between January 2 and March 18, 2020. The WHO-China Joint Study Report, released on March 30, 2021, came to a clear conclusion and made recommendations for the next phase of the global investigation into the outbreak's origins, concluding that the Wuhan lab leak hypothesis is extremely unlikely, and that we should look for possible early cases of the outbreak more widely around the world and learn more about the role of cold chains and frozen food. Zhao stated that the report's results and suggestions should be accepted and followed, as well as reflected in the next phase of research into COVID-19's beginnings.